Hi, this is Gary Jones with Gary's Little Corner. Thank you for joining me on my channel. Uh, I have a secret that I want to tell, and I've held it back for a long time. I have the beginnings of dementia, and it's starting to get worse. My trip here to this dementia level started all the way back in 2012. At that point, I got Rocky Mountain spotted fever from a tick bite, and it evolved into a case of encephalitis. If you don't know what encephalitis is, it's an inflammation of your brain. And that inflammation eventually goes away. You can have long-term effects like continued seizures, remember the problems like I'm having, for example. Some people end up invalid in bed and the rest of their life. So I feel lucky that I just have this one little problem left over from that. Uh, so I do take medications for dementia and have for probably about 10 years now. So what is it like living with dementia that's getting worse? Living with dementia as it worsens can profoundly challenge both the person experiencing it and their loved ones. And here's some aspects to what it's like. Uh, Eventually with dementia, you start having cognitive changes. You start having increasing difficulty in remembering recent events, names, faces. Long-term memories may remain intact for longer, but they eventually fade. Like myself, I have a very difficult time remembering people's names. Even people I've known for years and years, I'll forget their names, and they'll have to remind me. Sometimes if I'm in the shower, for example, I have to be very routine about it, because if I don't, I'll end up getting out with some body parts that haven't been washed. The other thing is I absolutely need lists. I need lists when I go to the grocery store, so I actually remember why I went into the store to begin with. Um, Feeling confused can frequently happen, especially about time, place, and even identity of people. And this can just lead to some disorientation and anxiety. Now, once again, I get confused about time. Most of the time, I don't know what day of the week it is. I don't know what month it is sometimes. I usually get the year right. uh, so you have problem identifying people. And once again, this can lead to some disorientation and anxiety. And I've had that feeling before when I've tried so hard and long. Remember, like, just the name of a medication, and I used to prescribe as a nurse practitioner, for example. Uh, you sometimes have trouble finding the right words, following along with conversations, and understand written or the spoken information. Now, this has not occurred to me yet. I could read quite well. I used to write, actually, myself for a medical uh, uh, publication company called Willis and Kluwer, and I did that for probably about like 14 years. Though I did a lot of writing. So you sometimes have problems finding the right words. I do. Sometimes I struggle to find that word that I'm looking for. So sometimes I'm able to just substitute something else for it, and that way I can get through this conversation. Now, having the beginnings of dementia or having full-blown dementia comes with some emotional and psychological effects. Realizing one's declining abilities can lead to some frustration, sometimes anger. So, the person with dementia might have outbursts of anger. The awareness of the decline can cause sadness, fear, and anxiety about the future. I have some of those feelings myself about myself. Mood swings, can be unpredictable. Their mood might swing from one direction to the other, and the personality sometimes can change, and this can occur sometimes very rapidly. The person you see may not act like or talk like the person you used to know for most of your life. You can end up having some issues with physical changes as well. The coordination and mobility issues, dementia progresses. Physical abilities may decline, leading to difficulties with coordination and balance and movement. I do sometimes have problems with that. If I'm standing somewhere and I turn to my left or to my right, it may cause me to stumble and almost fall. And I've caught myself against the wall or a piece of furniture many times, and I've had a couple of falls because of it. Fortunately, I didn't break anything. Changes in sleep patterns, irregular sleep patterns can occur. And nighttime restlessness can become very common. Now, in my situation, I typically don't get to sleep until about 1:30, 2:30 in the morning. And then I sleep in, of course, but I just have a very difficult time going to sleep if I didn't have medications to take to help me do that. There can be, for the person with dementia, some challenges with daytime living. And they can have problems with routine tasks that once were simple, such as cooking, dressing, personal hygiene, and this can become increasingly challenging, or where they need to be in a full-time setting to help them with those problems. Fortunately, I can do all those things for myself. Once again, like the personal hygiene, I got to make sure I'm routine about what I do, so I make sure I get completely washed. Dependence on caregiver can increase their need for assistance with daily activities, leading to a loss of independence. I fortunately am nowhere near that yet. Safety concerns are present. There's a greater risk of accidents and wandering off and requiring careful supervision. And this would be like with a person with like more of a full-blown Alzheimer's dementia type of characteristics. So they need coping mechanisms in place. So a good support system is important. To have a network of family, friends, and healthcare professionals available to the person with dementia or Alzheimer's. Routine and structure, maintaining a consistent daily routine can help provide a sense of stability. And keeping them active, participating in activities to stimulate the mind and body, tailored to the individual's needs, that can really help as well. Now, one thing I think helps me is like making these videos and reading. Watching TV, it's a passive activity, so you want that person to be more into activities where their mind is engaged. Now, there was a study done on a group of nuns years and years ago now, and none of them had Alzheimer's. None of them. According to the general population and the incidence of dementia and Alzheimer's, at least one or two of those nuns should have had the disease process. However, none of them did. Now, back in the old days, the only way they could, really determine whether a person had Alzheimer's, which includes plaques and tangles inside the brain, is to actually on autopsy. So you had to die so they could prove you actually had Alzheimer's. Well, they did that on these group of nuns, and they found out that, yes, they did have plaques and tangles. An assortment of them did. However, none of those people showed any signs of Alzheimer's. And once again, they credit that to that they were active mentally all the time and engaging their brain. So that kind of gave them a protective shield. Now, from the perspective of the caregiver, it can take an emotional toll. They can often experience stress, grief, burnout. They need time. They need some downtime, the caregivers do. So taking breaks and seeking support to manage the caregiver's responsibilities, like having a backup person, is very helpful. Overall, living with worsening dementia is a complex and deep personal experience, and it varies from person to person, though it requires a compassionate, patient, and supportive approach from everybody involved in that person's life. And so right now, mine isn't very bad. I try to keep my mind active. Doing these little YouTube videos really help do that because I'm always trying to think of topics and try to write out the topics that I'm going to talk about. So if you do me a favor, this is Gary's little corner of information once again. If you would click like on this video and subscribe, here at the end of the video, it'll show you those options, and it will help me out a lot. I am going to post a link to the video that I did before about whenever I had encephalitis, and so you have a full understanding why I have the dementia that I do. So I wish you all a good rest of your day and rest of your evening, and this is Gary's Little Corner signing out. Bye-bye.